Well, hello, hello, hello to everybody in my awesome, amazing community. It's Teresa Sanderson, and today I just want to talk with all my nursing peeps about how to stay in nursing without burning out. Okay, this is very, very relevant for today, and so I just want to chat with you quickly about that. So, if you're catching me live, please feel free to say hi. Let me know where you're watching from. If you catch me on the replay, comment hashtag replay. And if you catch me on YouTube, don't forget to hit that subscribe button so that you never miss an episode. So, thinking about nursing in the days of the COVID-19 pandemic and all of this kind of thing, nurses have been under an incredible amount of stress for more than a year, right? The problem is, though, that nurses were struggling long before COVID-19 ever reared its ugly head. And so what this has done is just add fuel to the fire of burnout. And so it's really, really important for nurses to understand what, to be able to even take a minute, right, and understand that what you're going through is real, first of all, this sense of overwhelm, anxiety, dread before you go in for your shift. All of these things are very real, and they're also very normal for people who are undergoing an incredible amount of stress and who have borne that stress already for a very long time. Okay, so I give this message today with great love for everybody who is working in nursing, for all my dear nursing peeps, and just want to share with you a couple things. So this question came up in another group of mine that said, so for those of us who are going to be sticking it out with bedside nursing, what are some suggestions, what are some strategies that you can say we could use? Because let's face it, not everybody can just leave the bedside and go to work as a telephonic nurse case manager, right? Very, very true. Very true. So my personal take on this is that it's going to take a lot of self-care to make the job of bedside nursing, and almost these days, any kind of nursing that you may be doing, it's going to take a lot of self-care to be able to push yourself through. So one thing I want to put out of your mind is that we all think of self-care. It's some kind of great buzzword, right? Everybody talks about it, but how do you really do it? Is it even possible to do it when we're already so stressed and short of time? And the answer is yes, you can do it. And for me personally, it is so much more than a buzzword. The reason being, I crashed and burned in 2010 from major depression, brought on by long-standing chronic stress in the field of nursing. And what I was doing, I was working as a hospice nurse at the time. I owned my own hospice agency, was committed to excellence in all things, and right? So we know how this goes. We know how this goes. And unfortunately, I didn't recognize all of the warning signs in myself. Things like overwhelm, anxiety, and then suddenly just one day I wasn't able to get out of bed anymore. And so major depression and burnout literally plucked me out of the workforce for 3 years. And it was all of that time during recovery that I learned truly what self-care is all about and how it is a lifestyle change. Okay, so I want to talk to you today as I talk to you about how to stay in the field of nursing, how to stay working at the bedside without burning out. I am talking to you just as we as nurses would talk to any patient who had COPD, who had diabetes, who had heart disease. And what do we teach them about? We teach them about lifestyle changes, right? Lifestyle changes. And that's what self-care truly is. And when you can embrace it as a lifestyle change, you're going to be well along the path, because that's what we have to do. We have to change the status quo. We can't just continue to bear the same stress the way we've always done it. We're going to get the same result. And what is that? That is nurses burning out and leaving, or desiring so desperately to leave, the bedside and or the field of nursing altogether. Okay, so I'm not here today to teach you all about what self-care is, but I want to plant the seed that, of course, I think we all know what it would look like. It would look like you take a lunch break every day at work. You drink enough water when you're on your shift so that, yes, you do have to go take a potty break, right? But you need to stay hydrated because you're going to think more clearly. You need to nourish yourself, and I would encourage you, when you take your lunch break, take it off the floor. Okay, there's nothing worse than somebody coming in and saying, hey, I know you're on your lunch break, but I've just got this thing that I need to ask you about right now. I can't wait 20 minutes until you're back. right? There's nothing worse than trying to take a break, literally being off the clock, and somebody interrupting that valuable, valuable time for you, right? So grab your lunchbox, whatever you got, go down to the cafeteria, sit at a table by yourself, whatever you need to do, or with some of your besties that you can laugh with for 20 or 30 minutes, and do that. But be off of the unit as much as you can during your lunch break, okay? I want you to, drink enough so you can go potty, and I want you to also do some deep breathing. And there's a special strategy and a special kind of deep breathing that I'll be teaching on in a couple days that is very, very useful for this. So other than these things, you need to be able to rest, relax in your time off, right? Really be able to get some good rest and just take care of yourself overall. So these things are vitally important. And the really cool thing about self-care is that when you learn it, when you embrace it as a lifestyle, you're going to do a few other things. A few other things are just going to come along with it. Number one, you're going to be able to set boundaries. Okay. You're going to know what works for you and what doesn't when it comes to taking care of yourself first. And that's what I've got to ask you to do. If you want to stay in nursing for the long haul, you've got to take care of yourself first. Okay. So you're going to learn to set boundaries. You know, maybe your phone is just going to be off when you're not at work, and you're going to have to ask your boss, or just say assertively to your boss, when I'm not here, my phone is off because I cannot have these interruptions of being asked to come in on my day off. Okay. Also, you're going to learn how to say the difficult things and have tough conversations. You're going to be able to say the hard things, even when it's challenging, even when it's difficult. You're going to be able to express yourself, because another way of looking at depression is a lack of expression. And that is very, very true. The other thing that you're going to be able to do is just really know and understand that you are valuable, you are worthy, you deserve all of this goodness. So think about yourself in this frame of making a lifestyle change. Again, much like we would tell somebody who has diabetes, who has heart disease, who has COPD, there are a few things that you're going to need to do to be able to take care of yourself and live a long, healthy life, right? That's what we would tell a patient, and we don't always have personal relationships with our patients, right? These are people we barely know, but we give them a lot of great information about how to take care of themselves for the long haul. I need you to look yourself in the mirror and give yourself that same advice. Okay, that's what I'm asking you to do today and all of these days forward. So thank you for joining me today. I want to be sure and invite you. I have the 30 Days to Ignite Your Inspiration Challenge starting for the very first time on August 1st, 2021, right in my personal Facebook group. It's called Inspired Nurses, Taken for Granted to Taking Charge. And if that resonates with you, I want to have you in there. If you have forgotten what you used to love about nursing, if you've lost that pep in your step and that zeal to just be able to come and do it, if you find yourself dreading every shift that you're going to be working, this challenge is for you. The Inspired Nurse community is very, very uplifting and supportive, and I hope you will connect with us there. Thank you for tuning in, and I will see you soon. Bye.